I'm here today to talk about one of the most pressing issues facing our nation and our economy, and that's healthcare. Today it accounts for more than 17% of the U.S. GDP. That is equal to more than $3 trillion, or about $10,000 per person. About 10% of that spending is due to prescription drugs, and I'll come back to that in a few moments. The other 90% of U.S. healthcare spending can only be addressed by what we consider to be fundamentally transforming the healthcare system itself, which, as we all know, is not delivering the value that it should. We look at today's healthcare system as one that is episodic, it's fee-for-service, it's a fragmented model, it's confusing, it's difficult to navigate for many. It doesn't meet people where they are, give them the information they need, or help them connect what we refer to as the dots of care. So in the end, it doesn't put consumers at the center of their own care, which is where they really need to be, because consumer-driven healthcare is increasingly becoming the norm. Today, more than 30% of covered workers are enrolled in a high-deductible health plan, or as some call them, consumer-directed health plans, and that compares to just 4% a decade ago. We have pushed people to become more accountable for their healthcare decision-making, but the tools, the capabilities, and the products and services that they need haven't kept up. And many consumers don't really know how to use what's available to them. Importantly, healthcare is not a commodity, and it can't function effectively with a one-size-fits-all approach. So in creating a more affordable, effective, and better healthcare system, I would argue that we need disruptive innovation from within the healthcare system itself. And the combination of CVS Health and Aetna is designed to do just that. We were very pleased to announce just last week that we received clearance from the Department of Justice to proceed with the transaction, and we expect to close the transaction in the fourth quarter of this year. So let me take just a few minutes to explain how bringing together CVS Health and Aetna as one company will help bring about the disruptive, transformational changes that are more broadly needed in our healthcare system today. So let me ask you to think about your own experiences in healthcare. I'm going to ask you, are you a patient? Are you a consumer of healthcare, or are you both? Well, if you're sitting in the exam room in the doctor's office, or heaven forbid, on the operating table in the hospital, you most certainly are a patient. You're relying on the physician's expertise to diagnose, treat, prescribe a course of treatment. And let me go ahead and introduce you to Diane. Diane is a person with a new diagnosis of diabetes. She leaves the doctor's office with a care plan. It will have instructions for new medication that she'll need to take. It'll have lab instructions for blood work to measure her sugar levels. It'll have instructions for her diet, instructions to lose weight. But will Diane know how to execute her care plan effectively? Her doctor warns her that if she doesn't get her blood sugar under control, her risk increases significantly for diabetes-related complications like heart and kidney damage. So it's at this point that Diane just isn't a patient. She's now also becoming a consumer of healthcare, because you think about it, as a patient, she has gotten expert advice from her physician. But as a consumer, she is now accountable for finding and accessing the services that are called for in her care plan in the most effective and affordable ways. And as a consumer, she is now engaged in the steps that she needs to take to follow and execute that care plan to stay well. Now, fortunately, whereas she might see her physician 4 to 5 times a year, she is likely to see her pharmacist as many as 18 to 24 times in the same year. And this is just one example where the combination of CVS Health and Aetna can make an important difference. So we think about this new company leading the change that's needed in American healthcare in 3 important ways. First, we will be local. Today we have a presence in 10,000 communities all across the country. And our combined company will be able to offer many options to access care, whether it's in the community at a retail pharmacy or clinic, or perhaps in the home, or through digital tools and capabilities. Second, we will make it simple. Through our combination of data, information, and expertise, we can make this often complicated and confusing system easier for all. And third, we will work hard to improve health. We will be uniquely positioned to help to personalize healthcare and help people achieve better health at a lower cost and access care when and where they need it. And I'll look forward to expanding on this vision, I'm sure, with David more in the conversation. Before I do, I want to come back to prescription drug spending. I mentioned earlier it accounts for about 10 cents of every healthcare dollar. We know many Americans struggle to afford their medications today, and some have pointed fingers at pharmacy benefit managers or PBMs, along with others in the drug supply chain as the cause for this. And one pharma CEO recently remarked that the supply chain was retaining up to 55% of the profits on prescription drugs. Now, as the leader of a company that is part of the supply chain, I am here to tell you that this is simply not true. What was left out of those comments is that almost all of that 55% flows back to employers, flows back to other prescription drug plan sponsors in the form of discounts. In fact, we project that this year, 2018, our PBM clients will receive about 98% of the discounts and rebates that we obtain from pharmaceutical manufacturers. And the truth here is that drug manufacturers set drug prices, and prices are higher for drugs that face the least amount of competition from generic products and other therapeutically equivalent alternatives. And the important role that's played by PBMs is to negotiate discounts from drug manufacturers on behalf of their clients, and to also deploy a variety of tools to ensure that their members receive high-quality pharmacy care at the lowest possible cost. And as an example of that, last year, 2017, drug price growth for our own clients was only 0.2%, 0.2% on a per capita basis, despite list price inflation of nearly 10%. And if you look across the entire PBM industry, these time-tested market-based techniques are projected to save the healthcare system more than $600 billion over the next decade. Through the combination of CVS Health and Aetna, we believe we'll also be able to do even more to help lower overall spending associated with prescription drugs by helping people stay adherent to the medications that their physician prescribes, which, as you would expect, can prevent more costly interventions like hospital admissions or visits to the emergency room. So let me summarize just a few of the things that I touched on. We'll be there when patients pick up their medications to talk with them face-to-face and answer questions. We'll expand the use of digital tools that empower patients to better manage their health and wellness. And these tools can help patients monitor key indicators. Think again back to Diane. Diane's managing her blood glucose levels. We can help her with that and actually send text to her or her caregiver when the results look concerning. We'll even be able to help some people avoid developing chronic disease in the first place. We'll have the data to predict who's at risk and the ability to provide them with preventative counseling in a convenient and local setting. And we'll be able to do all of this not in an ad hoc or fragmented way, but seamlessly with patients, their physicians, and many other players it takes to coordinate care. So the new healthcare model that we intend to create through this combination of CVS and Aetna, it's bold, it's disruptive, it's truly unique, and it's also achievable with the right engagement at the community level. We'll be local, we'll make it simple, and we will work to improve the health of those we serve. And we can't wait to roll up our sleeves and get started.